For cancer survivors, fighting cancer is the most challenging period of their life. For those that receive news that their scans finally show no evidence of disease, this often brings relief and a feeling of triumph. But for many patients, this feeling of victory is short-lived and can be replaced with fear and anxiety. Thoughts of cancer recurrence can create a sense of dread and waiting for the return of the disease. Cancer relapse rates vary widely depending on the type of cancer and the stage in which the patient was treated. According to studies published in Science Direct, most cancer types have a recurrence rate between 20 to 50%. Naturally, many cancer survivors are eager to learn nutritional and lifestyle modifications that can be applied to reduce their risk of relapse. Sadly, too many hospitals only provide patients with general advice about maintaining a healthy weight, exercising, and employing stress management tactics. Worst, most medical providers do not discuss what many believe to be the cause of cancer recurrence, that is, cancer stem cells. Cancer stem cells are a small subset of cancer cells that have the ability to self-renew, initiate tumors, and give rise to mature cancer cells that have the ability to spread. They are practically undetectable in patients and do not appear on cancer diagnostic scans. The world-renowned physician and scientific researcher Dr. William Li offers this description of cancer stem cells' role in cancer recurrence.
Kill cancer stem cells. Now, cancers are just an abnormal mass of cells, but when they keep on coming back, they need their own stem cells to regenerate themselves. You know, when a cancer patient actually has their tumor removed by surgery, treated by chemo or radiation, and you're done, right, for 5 years, but sometimes they come back. Well, the reason those cancer cells come back is because of their stem cells. That cancer figures out how to resurrect itself.
Furthermore, evidence shows that standard treatments like radiation and chemotherapy have little to no impact on cancer stem cells. The medical director of personalized medicine, Olena Ivanova, FNPC, is a leading provider of metabolic cancer therapies to advanced stage patients. She further explains cancer stem cells' role in recurrence and their ability to evade radiation and chemotherapy.
Cancer stem cell role in recurrence. Even when a primary tumor is surgically removed or seemingly eliminated by chemotherapy or radiation therapy, cancer stem cells left behind can drive recurrence of the cancer months or years later. Like a seed, a single surviving cancer stem cell can regenerate a whole new tumor. This may explain why cancers so often recur after periods of remission. Preventing recurrence likely requires targeting and eliminating the cancer stem cell population. Unfortunately, standard treatments fail to target cancer stem cells. Conventional chemotherapy and radiation target rapidly dividing cells, but have limited effectiveness against cancer stem cells, which divide much more slowly.
While there are limited pharmacological options to target cancer stem cells, scientific studies document that nature offers many foods that contain bioactive components that have the ability to kill cancer stem cells. For cancer survivors looking for ways to reduce their cancer recurrence risk, consuming foods and nutrients that have shown the ability to target cancer stem cells could be useful. Instead of analyzing thousands of articles from medical journals to determine which foods have anti-cancer stem cell capabilities, you can quickly build your preferred list of nutritional items by using the anti-cancer nutrition app, NutriLiv. NutriLiv includes an evidence-based catalog of foods, supplements, tinctures, and aromatherapy that can be searched based on anti-cancer and health-optimizing features. Users can quickly access a search screen to filter for items that have shown the ability to target cancer stem cells. This will provide an applicable list of vegetables, fruits, teas, mushrooms, and other food items. Selecting an item will take you to a screen that shows a list of observed anti-cancer properties, health-optimizing features, and details that summarize the anti-cancer capabilities observed in studies. A list of the source studies used in the item profile can be found at the bottom of each page. All items have a NutriPoint value that is calculated based on the anti-cancer and health-optimizing properties observed in studies. you can log consumption of items to track your progress toward meeting your goals. The NutriLiv app provides an easy way to apply information from medical research to make intentional nutritional decisions that can help limit the risk of recurrence. Open the video description to find links to sign up for the app today, as well as access studies referenced in this video. We hope you live long and live well.